Coco and Teal.
Welcome to another episode of Coco and Teal Speech Therapy. I'm Teal, this is Coco. In describing what selective mutism is, I'm going to read the ASHA definition for selective mutism. Selective mutism is a complex childhood anxiety disorder characterized by a child's inability to speak and communicate effectively in select social situations, such as school. An individual's pattern of mutism can vary greatly. Some children or adults never talk outside the home, some whisper, and some speak only with a select few people. The individual has not elected to withhold the ability to talk in all situations. Rather, the individual selects the situations and people with whom they verbally communicate, according to Richard in a 2011 study. Children with selective mutism typically do not speak at school, which interferes with academic, educational, and/or social performance. Children with this disorder sometimes communicate via non-spoken or non-vocal means, like pointing or writing. The prevalence of selective mutism, or the rough estimate of the children who are currently living with this issue, is around 0.5 percentage point. It affects more girls than boys, and it's also been shown to be more prevalent in immigrant communities or among children who speak a minority language. The cause of selective mutism is multifactorial. There's definitely a genetic component, a personality component, an environmental component, how we reinforce or de-incentivize certain behaviors. It is associated with certain anxiety disorders that may present later in life, and it's also been linked to a lack of social opportunities to practice communicating with a wide variety of people. Selective mutism is diagnosed by a speech-language pathologist. However, it's recommended that you're working in conjunction with a psychologist, psychiatrist, educational school counselor, teachers, family members, pediatricians, and all other important adults in that child's life when you make this diagnosis. Key diagnostic criterion to keep in mind as the diagnostic SLP would be that you have observed that the child is able to speak in at least one situation. However, in other situations, they don't have this ability due to their anxiety. There are multiple therapeutic interventions or strategies to try. The first one that comes to mind is giving this child an AAC device, either a low-tech like paper pictures they can use to communicate, or a high-tech such as an app on an iPad, but some kind of AAC system so that they're able to communicate in a way that makes them feel more comfortable. Another thing I would get going right away is some kind of visual schedule so the child is able to anticipate when changes are occurring and when they might be called on to use their voice. We can also use and practice scripts to help them feel more comfortable in a specific social situation, like showing up to school. And social stories are a great way to script conversation inside of a recurring social setting. We also want to use positive reinforcement when the child does talk in any setting. Remember the power of praise. And some parents and therapists take an exposure therapy route, gradually increasing the demands or expectations on a child as they ease them into situations that are more and more social or difficult for the child to communicate in. I worked with a little girl who was super verbal at home. She had a great vocabulary and was putting sentences together in a toddler fashion. But as she started preschool, she would show up and the teachers say she wouldn't talk at all, or when she finally was convinced to talk, it would be So we used some of these strategies, and over time we noticed her using her voice more and more in social situations. Her mom worked really hard to get her comfortable with the idea of school. They talked about school a lot. She bought her daughter special backpack and clothes that she could only wear when she was going to this exciting place, school. And over the course of a couple months, the selective mutism did work itself out. If this is something you suspect that your child is dealing with, I urge you to reach out to a speech-language pathologist who can help assess what's going on and why. If you have a story to share about selective mutism, please comment in the comment section below. And I'll see you guys next week for another episode of Coco and Teal Speech Therapy.